News Talk 760 WJR presents Living Pain Free with host Warren Pierce and special guest Jeff Morton. For WJR, here's Warren.
All right, Mark, thanks a lot and welcome in. Those of you who have not had an opportunity to hear about how lasers go about reducing or eliminating your pain, you're going to want to listen very carefully because we're going to focus on that for the next 54 minutes. And let's be sure that you know it affects the young and the old and everybody in between, men, women, when it comes to, well, pains in your head, migraines, for example, or maybe a rotator cuff injury or a knee tendon rupture, plantar fasciitis down in the foot area, whether it's your head or your feet or anywhere in between, lower back, then the next few minutes are going to be designed with you in mind, or someone you know, maybe a member of your family, somebody that you work with, as we check in with the director of the Pain Free Life Centers, Jeff Morton. Good news, too, you continue to expand as so many people begin to take advantage of the laser, opening in Shelby Township soon, within, the month or so, in addition to where you are now in Troy?
Yeah, we're shooting for 45 days, so about the middle of March. We're going to be in Shelby at 24 and Shaner.
All right, and for those who are listening for the first time, and they've got some sort of pain, no matter where in their body it is, and what is it? Pain, the number one reason, I pointed this out before, why Americans seek healthcare. There are more Americans suffering from pain than from diabetes, from heart disease, and cancer combined. That's according to the National Institutes of Health. And so often when people experience pain, they're seeking ways to somehow reduce it or eliminate it by going to, among other things, what? Drugs?
Opiate drugs is a huge addiction in our society today. And one of the things we strive for at Pain Free Life Centers is to get people off the drugs. The injections that don't work, or they're a temporary mask of the pain. And by all means, we try to get them to avoid surgery with our laser therapy.
No doubt about that. In addition to chronic pain or pain lasting more than 12 weeks, and you've seen this certainly there with the folks that you see, it can lead to other health problems, maybe sleep disorders or limited movement, and even depression comes into play here as well with those going through these pain problems.
Well, yeah, and the newest commercial that's out right now is for opiate-induced constipation, right?
Uh-huh.
And now they've even termed the term for what happens when you take opiates, you get constipated, so now there's a pill that helps you get regular. It's ridiculous. And the opiate drugs, they tear up your stomach, your liver, your intestines. They're just bad. They're just bad for you. It changes your personality, your attitude. You can't work. Machinists can't run or operate machineries. You can't drive. And all opiates or injections do is mask the pain at the nerve ending. Laser therapy penetrates below the skin to the source of the pain and allows the body to heal by producing photobiomodulation, which I know, Warren, is your favorite word.
Yeah, exactly. But these specific wavelengths of life to create this therapeutic effect?
Yeah, it creates a physiological change in the body where there's a lot of things that happen, but the major things that happen is the laser creates an unhealthy cell and makes it healthy again by making it produce ATP, or adenosine triphosphate. 2, it is a vasodilator, so it increases the blood flow to the area that we treat. Everybody knows that blood carries oxygen, enzymes, and proteins that the body needs to heal. And the biggest thing it does is it releases a chemical called nitric oxide. It's an enzyme that our body produces, which is our natural anti-inflammatory. So what do? The laser penetrates non-invasively, increases blood flow, sends the energy that the cells need to get healthy, creates healthy tissue, and reduces inflammation so the body can heal.
Yeah, and you become so frustrated, too, when folks visit your office. They've tried all the items that you were just mentioning, and you want to say, well, why didn't you come here first? This is non-invasive. It's the use of a laser, and the strongest laser that can be used anywhere in the state of the country, for that matter, instead of having gone through all these other things, including surgery.
Right. I had a patient come in today, 35-year-old male, had a cortisone injection last week. It didn't work. He's slated for surgery March 27th, After one treatment, his pain was reduced by 40%. He got up off the table. He signed up for his program, and he said, Jeff, I'm canceling my surgery. After one treatment, he got more relief than all the opiates, the injections, and the physical therapy that he's gone to. And at Pain Free Life Centers, we're really passionate about teaching people that there is an opportunity and a modality out there that is totally non-invasive, that isn't going to hurt the body, and it gets results. It's the same pain management that the Pittsburgh Steelers use in their football team. Their team doctor has 5 lasers that we have. We're the only center in Michigan that offers high-dose laser therapy. There's no joke. It's a serious piece of equipment, and we're the only ones. We have the exclusive rights to the high-dose laser therapy in Michigan. Nobody else can do what we're doing.
And remember, Jeff, we were talking, last year at this time, following the Super Bowl, about that, Carolina Panthers, Jared Allen, who during the playoffs broke his foot or his ankle, something in there, and they used a laser to strengthen it, to reduce the pain so that he, in fact, last year was in the Super Bowl game.
Yeah, he had a fracture in his foot, and he got laser therapy 3 times a day for 7 days a week for 3 weeks, and the fracture actually healed. And he's not the only sports, celebrity that gets treated. John Ogrodnik used to play for the Red Wings. Johnny O, he had an Achilles tendon sever. 8 weeks after his surgery, we had him back in a skate. Dave Rosema, 5 arthroscopic knee surgeries. We treated his knee before he had his knee replaced and after he had his knee replaced. And I can't talk about the current athletes that we treat, but, it's amazing what we do. We have people that come from as far south as Columbus, Ohio, Bowling Green, Ohio, as far north as West Branch, Owasso, Alpena, all the way from Grand Rapids, and these people are driving in 2 to 3 times a week because laser therapy is a cumulative treatment. It's not something that you flick a switch and boom, it's done. And I want the listeners to know that we're so busy. The wellness directors, Tammy and Michaela, are at the office right now.
Okay.
Taking the calls, booking appointments. I mean, I've already got 17 new patients booked for the rest of this week. What's today, Thursday?
Yep.
So I have to work overtime this weekend. So listeners...
Well, that's okay because you took off last weekend to watch the Super Bowl game.
Did,
so
yes, I did.
You got to be back in the office. These people need you, Jeff.
They do.
And we should point out that Jeff Morton is so sure, and the folks at the Pain Free Life Centers are so sure that they're going to be able to help you. First consultation, there's no charge, and the first treatment with the laser, and we'll talk about how it works, and we'll meet one of your patients who's come in tonight, and we'll certainly invite the listeners to call too. But you're so sure that that consultation and that treatment is going to be free, and the number to call, because as we know, doing this show for over a year or 2 now, the appointments book up. 248-879-1100 is the number to call, and you've got 2 of the wellness coordinators in tonight, making sure that they're marking the names down and setting up appointments as well. And if you have questions for Jeff, feel free to call WJR directly, toll free, 1-800-859-0957, 1-800-859-0957. If you've got a pain in your shoulder, in your foot, your lower back, or someone in your family is experiencing some pain, and like Jeff said, they've been trying drugs, or you've tried, who knows, surgery. It's not too late. Surgery didn't work. You need to call in and talk with Jeff, and he'll explain whether he can help you, and chances are he can, reduce and eliminate the pain, or he'll say, you know what, this is what you need to do as an option instead of checking in here at the Pain Free Life Center. So our number here is 1-800-859-0957. You'll talk directly to Jeff. Tell him what your pain is, what it's all about, or someone in the family, or someone you work with, and he'll be able to help you out for sure. And we want to meet one of your patients, too, that you brought into the studio. So we'll do all that. We'll take a break here on News Talk 760 WJR, and then continue here on a very cold Thursday night. So you all stay with us.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR.
I don't understand it, and it frustrates me. Why are people still taking drugs, getting injections, and having unnecessary surgeries? Why are you? Are you ready to start living a pain-free life? Do yourself a favor and call Pain Free Life Centers today. 248-879-1100. For years, you've been hearing me talk about the benefits of laser therapy. It's totally non-invasive, and it's been cleared by the FDA. I challenge you, no, I'm begging you, give me the opportunity to give you a better quality of life. Call the office today. Come on, what are you waiting for? Start living a better quality of life today. Go to painfreelifecenters.com or call 248-879-1100. We're so confident in what we do, we're going to give you a free consultation and a free treatment. You have nothing to lose but the pain, so lose it. Pick up the phone. Do it now.
Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain-Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And welcome back in, those of you who have experienced pain, someone you know who is experiencing pain, maybe in your family, at work. We're talking about 100 million Americans suffering from chronic pain. And when that pain persists, everyday activities, even driving a car, sitting at a desk, going to the supermarket, can become daunting. As Jeff, you bring in a guest with you, Tim Nera is in the studio, and back in 2013, 4 years ago, Tim, you have a right knee replacement, and you're in the construction industry, so yes. Who knows, maybe all the work you did with your body was contributing to the bad knees, but you go in, have a knee replacement done in 2013, and the result is what?
The result was that everything was fine in the beginning, but I got an infection. The infection led to a revision surgery, which means they take out the implant, put a antibiotic blocker in the knee, and put you on an infusion pump to get rid of the infection. And then, after the infection is gone, replace the knee. And that leads to a lot of scar tissue.
And when it comes to scar tissue, Jeff Morton, how does the laser come into play? Because we've pretty much talked about those who are suffering from pain, but not necessarily those who have already gone through like a surgery here, and then this scar tissue develops. What can that cause in terms of pain for someone like Tim?
Well, it can create range of motion issues. It can create nerve impingements. It can get caught in the joint. I see a lot of it. We treat a lot of scar tissue. Dave Roseman was a perfect example. But when you cut the body, the body's not meant to be cut open. And when you cut the body, it has to heal. And the way it heals is by developing scar tissue. So the laser can recognize the foreign body in the scar tissue and dissolve it. And it makes the scar tissue go away.
As a result of that surgery, what were you experiencing then, Tim?
Well, during the course of the time, the doctor told me that you're going to have problems going up and down stairs because of the scar tissue. It just escalated in the time frame after the surgery, and my range of motion was somewhat limited. But the pain factor, that was where the problem was. Because at night, like Jeff was alluding to, if you're in pain, you're going to wake up in the middle of the night and you're not getting your proper rest, and the issue becomes more amplified.
As a result of the pain,
correct.
What were you doing, or what was the doctor, the surgeon suggesting you do to reduce or eliminate it?
Well, the one doctor told me that your knee has been beat up really bad. You're just going to have to deal with it. And
the pain,
just like that.
Suffer.
Yep. And I was given oxycodone, and I'm a big no-drug person. The bottom line was it didn't even have an effect on the pain. And I was listening to your show, and obviously Jeff was on it.
Sure.
And I'm thinking, I've got to try something. And I called, made my appointment, and I couldn't believe after the first session, and therefore I signed up. And it's been probably about 6 to 8 weeks that I've been doing this, and My range of motion is much better. My movement is better. Walking is not a problem like it was in the past. So, therefore, it's been very beneficial to me.
And Tim, but you, last year have your knee replaced?
My left knee.
Yeah.
Which didn't have any problems. It was all with the right knee. Well, what I mean by that, the left knee had to be replaced. But the right knee, because of the 3 surgeries in a 6-month period, and the scar tissue just amplified itself through the course of time. And the pain medication was not doing it.
What about work?
Well, I was limited. So most of the times I would be able to go to the job, but on a very limited time frame because I couldn't stand. I'd have to sit down.
And when you arrived then at the Pain-Free Life Centers, what did they do for you? What were they suggesting? And how skeptical might you have been, even though you heard Jeff talking here on WJR last November?
Well, because it's something that you can't see or actually feel, you would be skeptical about it. And so I'm thinking this is like a last resort effort. When I went there the first time, it seemed to, my knee seemed to improve. The second one, there was a much greater improvement, and as time went on, it got better and better and better.
And Jeff Morton, Tim comes in. You have that consultation, which, again, is free. The first treatment is going to be free. You ask for at all his MRIs or X-rays, or don't you even need that when someone comes in and tells you and shows you where the pain is coming from?
Well, sometimes, Warren, I like to look at an MRI, mostly if it's back issues, because I want to know whether you have, sciatic nerve pain, if it's bulging disc, herniated disc, spinal stenosis, foraminal stenosis, just so I can give the patient a better idea of long-term prognosis. But the treatment area is pretty much the same for all of those conditions. In Tim's case, I see so many scars and so much scar tissue after people have their hinges replaced.
So the scars create the pain? Is that where it's emanating from?
Yeah, where they cut the body, the scar tissue develops around the joint. So it can impinge a nerve. It can wrap around a nerve. I mean, 3.5 years ago, I had this 23-year-old girl come in from Maumee, Ohio, who had her gallbladder removed, just a 1-inch scar under her rib cage, but scar tissue had developed and it had wrapped around her upper GI area and her esophagus. She couldn't eat. Now they were sending this girl after 2.5 years to pain psychologists and all these things. In 6 weeks, she was back to normal. So it's if you have to have your knee replaced or shoulder replaced or hip replaced because of something that is broken or wore out, that's good. I mean, get that done, but come see us after the fact because A, you're going to heal 65% faster post-surgical, and B, scar tissue is not going to develop and the complications are much less. But it's important that you have to do your physical therapy routine and do your workout and everything that the doctor says to do. The laser just helps the body heal quicker. I've had people come in that weren't able to get surgery because of their health issues, and they use the laser to manage their pain without the drugs. I mean, all kinds of people from all walks of life come to Pain-Free Life Centers, and we're blessed because we're able to change lives on a daily basis.
So, Tim, you go over to the Pain-Free Life Centers. You get that free consultation, that free first treatment as well. Were you familiar? Did you understand what was going to happen at all, how they were going to treat you using a device that wouldn't even touch your skin, but just be moved over, for example, your knee area? It would emit that laser, but it wouldn't even touch the skin and almost feel warm and therapeutic while they were doing it.
Not having a medical background, obviously my knowledge is extremely limited. So I went online, looked at the various laser techniques that they used, and saw that after listening to how they explain things and got more in depth with Pain-Free Life Centers, how it actually affects the tissue. And again, as time went on, the range of motion, the lessening of the pain, because I started out with a pain level between 8 and 10. At this point in time, when I go in there, it's 0.
Well, and Jeff Morton, it's really a handheld device used by the clinician over there, about, I don't know, the size of a flashlight or something like that, and then it's placed directly over the injured area, and then you figure out exactly, okay, how long is this going to be, how strong should the laser be, and how many treatments will you need to eliminate or reduce the pain.
Yeah, that's true, Warren. We're at Pain Free Life Centers. We're the most experienced laser pain clinic in the state of Michigan, and probably the country. I mean, I have the owner of the laser company fly in at least once a month to see what we're doing. Mm-hmm. Nobody else in the country is doing what we're doing with being a standalone laser pain center. We see between 70 and 85 patients a day, and that's all we do is treat people with pain. That's why we have to grow, because we're pretty much at capacity in Troy, and so people need to make the call and get in, and you can pre-book for Shelby. We'll allow them to do that, and we may even offer a discount for people that pre-book Shelby, but it's not going to open till the middle of March. But because of the experience that I have, and I've been doing this for eight or 9 years, we've developed the protocols that are tried, tested, and true, and they work. The laser's been cleared by the FDA, but prior to 2011, there weren't a lot of clinical studies to back up the information. We've helped a lot with that. So I've got it down in the crew at Pain Free Life Centers. They have it down to where you come in with a condition. If you listen to us and follow our procedures and protocols, you're going to lose the pain and you're going to live a better quality of life.
But remember, and we've talked about this before, historically, the laser was initially used on animals. We're talking 3 decades ago. So this isn't anything new. And in fact, you point out, usually around Kentucky Derby time, that's kind of surprised me, is before or after races, they use the laser, and they have for years, on the horses?
Yeah, because what happens is, how does the body recover? You increase the blood flow to the muscle and to the tissue, and the body heals faster. And that's the crux of what the laser does. The laser improves blood flow and reduces the inflammation at the same time without any side effects. It's literally life-changing, and I'm very passionate, Warren. We've been talking for years.
Yep.
It drives me crazy when I see people come in that have had multiple back surgeries. They're still in pain. They've got cages.
They're taking drugs.
Taking drugs.
Ruining their stomach.
Yeah, Tim, his story about the knee,
yeah,
that's not the first time I've heard it. I mean, I had a patient come in, the doctor didn't test him for metal allergies, put a titanium knee in, and the guy wound up getting his knee amputated. So it's gosh, I just want people to use surgery as the last resort.
All right, and you've heard Tim Nera talking about his situation, his knee replacement, and how the Pain Free Life Centers have helped him. If you have a quick question, give us a ring and we'll put you on the line with Jeff. Either it's someone that you know or somebody that you work with. Maybe it's you. If you have a specific pain, call us toll free, 1-800-859-0957. 1-800-859-0957 before we run out of time. We'll take a pause here and continue on with Jeff Morton and doing our best to help you or someone you know out eliminating or reducing the pain, whether it's your head, a migraine headache, plantar fasciitis, or anything in between. And we will return momentarily here on News Talk 760 WJR.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And since we've been talking for the past few years or so, you've been in Troy and now getting ready to expand to Shelby Township. That's good news, to be sure. And also we should throw in veterans. You are reaching out to veterans to take advantage of whatever pain they may be experiencing through the use of your cold laser.
Yes, Warren, it's very exciting. I have had a passion for veterans my whole life. What I want to do is I want to take veterans, corpsmen, people who have been on the front lines that have medical experience. You know, they save lives and then they dispense drugs. I want to train them to be laser techs. And we just signed a contract with Spartan Medical. Spartan Medical is a service-disabled, veteran-owned small business, and we are their official pain management and wound healing center. So we're going to take this national, but right now it's in Michigan only. So if there are any service-disabled veterans listening, you come to the office in Troy or Shelby when it opens. We'll give you a consultation. We'll give you free treatment, and we'll give you the paperwork to take to your doctor at the VA hospital, and the Department of Defense will pay for your laser therapy.
All right.
And that, for me, is a win-win-win because I want to treat the veteran. I want to train the veterans to treat the veterans.
Great job. And keep us posted on that as well as we go to our direct phone lines now. 1-800-859-0957. We want to hear from you in Rochester Hills. John, you're on News Talk 760 WJR with Jeff Morton. What was your particular problem or pain that you're experiencing?
Well, I have two questions. My wife has had issues with her feet for years. She's got plantar fasciitis. She saw foot doctors. She had surgery, and none of them helped. She still has issues with her feet, and I'm wondering, is this a possible solution for her? Is this something that could help?
And remember last season, Michigan State was Tum Narin?
Yeah.
Wasn't he?
Plantar fasciitis.
He's a basketball player. He was experiencing the same situation that John's wife is.
Yeah, John, we treat that all the time. As a matter of fact, we work really closely with the Lululemon store in Birmingham because it's a running store. And we treat plantar fasciitis. So what it is the plantar fascia on the bottom of the foot gets inflamed. It's inflammation.
Is that a bone?
No, it's a fascia. It's like a thin tendon that goes over the bottom of the foot, and it gets inflamed. And the problem is that when we're not sleeping, we're on our feet, and so the laser will increase the blood flow and it will allow the plantar fascia to heal. I have a 100% success rate with that condition. So that you should have your wife give a call and make an appointment to get in and see us. You know, if she can get in 2 to 3 times a week, by springtime she'll be running.
And you had a second question, John?
Yeah, is this an FDA approved kind of treatment? Is it approved?
It is. It's FDA cleared. It was cleared by the FDA in 2003. So that is not an issue.
Okay. How many treatments do you think it would take?
Well,
any idea there?
Yeah, I do. Depending whether she has a bone spur in her foot that's causing some of the plantar fasciitis, you're looking somewhere between 20 and 30 treatments for a complete healing process. There aren't a lot of conditions that I can say that I can cure because we're a pain management modality, but I've had construction workers with plantar fasciitis, these guys climbing on roofs, climbing ladders, no more pain. I've had police officers, Homeland Security guys. I've had marathon runners, professional hockey players, athletes. And if you follow the protocol that I set for you when you come into the office, your wife will live a pain-free life.
All right. So make that call. Do you have the number down?
Yeah, it certainly do. Is it covered by insurance, I hope?
It is not. Unfortunately, the American Medical Association won't give us a billing code. But I'll tell you this. Between the surgeries, the co-pays, your deductibles, the office visits, you've probably paid more out of pocket already for your wife's treatments than it'll cost you to do the laser therapy. So I want to make sure that you know that I can't put a price on the quality of life, but I can get rid of her pain.
All right.
All right. You mark the number down, 248.
Yeah.
879-1100. So call and make an appointment because the consultation is going to be free, all right? And the treatment is going to be free as well. And we should point out, too, Jeff, that you have the only laser pain center in the state that offers this HD laser therapy protocol as well?
That's correct, Warren. We're the only laser center in Michigan that has high-dose laser therapy. And there's a difference because there's a lot of chiropractors and there's podiatrists and even orthopedic surgeons that have low-level
acupuncturists. They're out there, too,
yes,
are trying to get involved with this.
Everybody's getting on the laser train because it is a paradigm shift in the way people are going to deal with their pain from here on out. It is so significant that it is going to change the course of history for the way that people deal with their pain. And the difference between high-dose laser therapy and low-level laser therapy is the difference between having a 150 horsepower vehicle versus a 700 horsepower vehicle. We have the power to be able to create the photobiomodulation at the cellular level and create the cell to change. Low-level laser therapy doesn't allow that to happen.
And as we mentioned earlier, Tim Nera, you brought him, one of the patients there at the Pain Free Life Centers, who, as a result of a right knee replacement back in 2013, had incredible pain that he was experiencing, went over to you. And, Tim, what was your experience, by the way, visiting the Pain Free Life Center out there in Troy, for example, and those folks that you worked with?
All the individuals that I work with treating me with the laser therapy, because I see various young ladies throughout the course of the program have been fantastic. They all are very knowledgeable about what they're doing, and they are very thorough about the course of action that they have to take to get you pain-free.
And you've got these special beds that people lay down on, that you administer the laser as well. Let me see if we can sneak one more in here before we have to take a break. In Sterling Heights, Robert, go ahead. You're on News Talk 760 WJR. What did you want to ask Jeff? And maybe he can help you out. What was your situation?
This is Bob Outland.
Right. Go ahead, Bob.
Okay. About a year and a half ago, I started experiencing pain between my leg and hip, and it got to a point that where I was kind of limping, and then couldn't get my sock on the left foot, and just kind of having it, and it was getting worse as time went on. So I heard this on the radio, so I'm giving you a call.
Well, wait a second. What have you done before you called Jeff here to somehow reduce or maybe eliminate the pain? Have you seen any doctors? Or
went to a surgeon, and he was going to have me go get an X-ray where they put an injection between your side, between your hip and your leg, to see, what effect that might have.
Sure.
I haven't done that yet. That's scheduled for the last Friday this month. But it's, I'm dragging around. It hurts. Some days worse than others, but that's what I'm experiencing.
Yeah, and on a scale of 1 to 10, what would you say the pain there in that area would be?
When it's hurting to walk, I can feel it all the time.
Yeah.
I do work at a dealer, going up 20 steps to the bathroom. I have to hang on to go up. Right. It's not like it used to be.
All right. So what about Robert here, Jeff? What would you suggest he do? Stop in, get a consultation? Obviously, he's in pain here and wants to somehow reduce or eliminate it.
Yeah, Robert. I believe that. I know we can help you. I want you to make an appointment and call the office and come in and let either myself or one of my wellness coordinators see you. That the issue with getting the injection is, A, it's going to be temporary, and B, the doctor doesn't even know if it's going to work. So,
what he said was it would tell if it was the hip or the back.
Yeah,
perhaps.
So when you come in and see me, I'll be able to tell you without doing an injection.
What is your name, sir?
My name is Jeff Morton. I'm the center director at Pain Free Life Centers.
Okay, and
did you get the number down there, Robert?
248-879-1100.
All right, so right after you hang up with us, what are you going to do?
I'm going to call.
All right.
All right.
Because the wellness coordinators are standing by, so do that right now, and we wish you well. You'll get together with Jeff, and no charge for the consultation and no charge for the first treatment. If you believe, and if the treatment is going to help, you're going to tell whoever comes in, you know what, maybe this isn't the right thing for you.
I had one person this week that I couldn't help, and I was honest with them, and they appreciate that. And one of the things that I'm incredibly authentic about is my passion to help people live a better quality of life. And if I can't help you, most of the people that I see have been sold a bill of goods by doctor after doctor after doctor. And if I can't help somebody, I'm going to tell them, because I don't want to be the guy that gives them false hope.
All right, get through to Jeff Morton before we have to sign off this evening at 1-800-859-0957. Maybe you've already been told by a doctor that you're going to need surgery. Maybe you've had surgery. Maybe someone in your family is experiencing pain, and it affects everyone around them. Give Jeff a buzz, and he'll see what he can do for you. 1-800-859-0957. We'll be back with our final minutes here on News Talk 760 WJR after we pause for these important messages.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And Jeff's around, too, bringing in a patient. Tim Nera is in the studio as well, talking about his knee replacement. And obviously, before we get to another caller incoming here, Jeff, for many people, this chronic pain that they're experiencing, like Tim, for example, the options offered by traditional doctors, correct me if I'm wrong, are not good enough. Long-term use of painkillers, they can cause, as we've mentioned, stomach problems, liver damage, addiction, depression, even deadly vascular problems as well, and pretty much a low quality of life.
How about overdosing?
Yeah.
Okay, I just had a patient today that I saw whose son, 30 years old, overdosed from pain medication.
Well, and I've read, too, where some drugs also require the use of other drugs to offset the side effects of the primary medicine.
Oh, that's exactly right. I sit and watch TV with my 13-year-old twin girls, and after the drug commercials come on, they're like, Dad, why would somebody take that drug? If a 13-year-old can recognize that these drugs that the doctors are prescribing for you aren't healthy, why can't adults? I mean, that's what I don't understand. It frustrates me.
Incoming, 1-800-859-0957 here to WGR in Shelby Township. Jeff, go ahead. You're on with Jeff Morton from the Pain Free Life Centers of Michigan, soon to be, in addition to Troy, in where you are, Shelby Township. So go ahead. What was your issue?
Yeah, not only is somebody's going to be in my neighborhood, I happen to live across the street. I didn't know they were moving in over there.
Stonebridge Medical Center.
Yeah, you got it. I live. I can walk to you.
Yeah. Okay.
Anyhow, I know your time's getting short, and I'm trying to be right to the point. I have 2 knee replacements, which are 6 years old. I did them as back-to-backers. And they've told me years ago that the left one was a lot stiffer and had scar tissued up because it healed up a lot faster than the right. I was sort of a test case on the way they put the sutures in. They did one differently than the other. Anyhow, make a long story short, I've always walked like I was Festus from Gunsmoke since that time. And I wasn't able to go to physical therapy the last couple of years to do something with it because it wasn't allowed underneath the insurance plan I had. I'm in my 60s.
Right.
Anyhow, by accident in December, I was 2 rungs up on a ladder and misjudged going to the floor as I was coming down the ladder and did a self-manipulation. on my right leg. Thought I broke my leg in half from the pain of it.
Right.
To my surprise, I didn't break it. I was able to walk and get myself up in the house. And the next day, instead of getting all discolored and swelling, my leg felt better. I've been thinking about going back up on that ladder and doing my left leg. Is a leg that's as old as like for 6 years where it's been scarred up? Are you able to do something with that?
Tim Narrow's sitting in the studio here. He's gone through that as well. What would you suggest here to Jeff, Tim? Because you had not only one but two knee replacements back in 2013 and again last year.
Again, the 2013, the right knee. So we're talking going on 4 years in October of this year. The scar tissue was hindering my ability to do daily things. Went to see the Pain Free Life Center, and after 10, 12 treatments, everything is virtual. My knee's never going to be normal because of the 3 surgeries, but it's much more functional and it is pain-free.
And Jeff, you can tell Jeff here too that obviously you can't correct the missing cartilage in the knee, right?
No, but Jeff, really, I've had patients that have had surgeries 15 years ago, and they come in and we take care of their scar tissue and the arthritic pain and the nerve damage that's been done. Nerve tissue heals, but it gets the least amount of blood in the body. So we can take care of you 6 years, 12 years. It doesn't matter to me. Scar tissue will make it better.
Oh, yeah? Okay.
Yep.
That's kind of what I wanted to hear. I would love to be able to get in and out of the tub without having to swing my leg up over it. And the other gentleman there knows what I'm talking about, and be able to get myself off the toilet without grabbing onto rails and stuff like that.
We're both on the same page. Mm-hmm. And believe you me, I experienced the same issues, and now I'm much more mobile, and I don't have a balance problem.
How much is the pain for you there, Jeff, in Shelby Township?
I probably am constantly a 4. And on my bad days, which right now is like a bad day, I probably will be a 7. But I also have had what they call cramping in that leg down below, which case when that happens, I go to a 12.
What about drugs?
I'm kind of not a drug person. I do have naproxen, which I take, but the naproxen is rough on my stomach, so I'm a teetotaler even with that.
Jeff, here's what I'll tell you. I know that.
Why don't you make him the first patient there in Shelby Township?
Well, I don't want him to wait that long. No. But here's the thing, Jeff. If you come into Troy, we'll transfer you over to Shelby when it opens in 45 days. But by then, you're going to have a 70% improvement in what's going on. So give us a call. Yeah? Oh, yeah, for sure. I mean, you look at Tim sitting next to me in 2 months. In 2 months, he went from an 8, 10 in pain to a 0.
Okay, I didn't hear the 2 months part of them, yeah.
All right, so even though you would have to limp across the street, Jeff wants you into Troy as soon as you can.
Okay, well, I do have the number down, and I will call. You guys will have to explain to Warren there what it is I did to myself and the pain I put myself through when that accidentally happened.
Well, we'll do.
All right. All right. Okay. Thanks a lot for calling in, and good luck. 248-879-1100. Remember, Jeff says the first one you can take is going to be free. The first treatment is going to be free. That's how sure you are, Jeff, that what you've been doing now for years will help out our listener, no matter where the pain is, head to the toe, and what most of the folks you see, lower back pain as well, right?
Yeah, if what we didn't work, Warren, we wouldn't be expanding. I mean, plain and simple. And we wouldn't have a position where we treat the veterans.
Continued success for Jeff and Tim. Thanks for stopping by in the studio. The number again, call it right now. The Wellness Coordinator is standing by at 248-879-1100. Thanks to Rich and Donald, and stay tuned.